Good afternoon, respected chairpersons. I think you are going to be having the longest chairpersonship, I think, in the whole conference, nearly 2 hours. Too many topics for you. And friends, you could have, yesterday and today, you could have heard in the orations how the diabetes is exploding in our country. And then one of the reasons, both Dr. Mohan and Dr. Ramchandran have said that it is the increase in the body weight. So now they have found that how it is increasing and all. But what is happening in the last 20 years according to the surveys that have been done? What is the impact, economic impact that our country is going to face is a very important aspect that we need to think about. Now, why is it we need to know that is that? I think if you understand that the amount of explosion of obesity that could happen, I think all of us have to rethink. And I think we need to inculcate in our practice that one thing is whether you are a diabetic or not a diabetic, we have to encourage weight reduction, whatever means may be. And then we are going to, after I speak about this, there is one more Jugalbandi, where what are the methods how we can reduce the weight and also reduction in obesity prevalence that can happen. Probably if all we work together. I think Dr. Usha and Dr. Kumar are going to have a good session for you, including pharmacotherapy and other things. And last, Dr. Ashok Kumar Das are going to speak to us. See, reducing the weight is one aspect, but sustaining the weight loss is the biggest difficult thing. See, a lot of people say that they have lost about 5 kilos of weight. In the next 1 year, they say, I put on 6 or 7 kilos of weight. That's what happens usually. So I think what is it we can do, and that Ashok Kumar Das is with his all knowledge and expertise is going to tell us how to manage the rebound weight gain as well. So I think this is I feel that it's about 1 hour of obesity. We specially designed it so that all of us will inculcate this habit into our practice. Sorry, sir, I took 2 minutes by you. Now, obesity is not a condition. It is like going to be an epidemic. All these years in the last 2-3 decades have been speaking epidemic of diabetes, epidemic of diabetes. Now it is going to be the epidemic of obesity which can cause diabetes, right? Now, it is going to be not just obesity increase, it is going to be the crisis of obesity which is going to have in our country. You can see that the data that have been shown yesterday and today, you could see that Southeast Asian people are more prone to get body weight. Right? That you can see that yesterday you could have seen Dr. Mohan's and today's Dr. Ramchandran's meeting. Now, just look at this. You can see here, there are about 50 crore women and 37 crore men who got obesity. Friends, it is not overweight, it is only obesity I am talking. Add overweight to this, numbers are going to be too huge. And the thing is that compared to what it was in 1990, where there are only about the obesity has increased like anything, about 40% increase in the last 20 years or so compared to what it is now. And this is going to, I'll show one slide where what is going to be the projection of future weight gain as well. So I think it is, if you look into that, what was obesity increase from 8.8% in 1990, it has gone up to 18.2, 10% increase. So this is what we need to look into. Now look at Indian map here. Now we look at the color coding, if you can see that in this side, obesity dominance. You could see here, obesity dominance, you can see that red, equal prevalence and underweight dominance, right? You see that what happened in 1990 in our country, both in women and in men, you could see that the underweight dominance, which is in blue in color, is changing to equal. Equal, both obesity and... So underweight is coming down. Obesity and normal weight is increasing. So that you can see, this is the same problem. In fact, if you can see in women, if you can see, both men and women is going to have the same problem. You can see here that is white, and in men it is increasing. Actually, you can see that it is going to, women are more prone to get obesity compared to men. This is the problem we are going to face in future as well. So I think women also should be taken care of. Now, if you look into that, in the next 10 years, what is the dramatic increase that you're going to have? You have that green.
It's not there, but you can use this.
That's not good. Green. Okay, don't worry. Just look at this. The Southeast Asia, which is colored in yellow, orange, that is Middle East countries, and next is Southeast Asia, that includes India, is the yellowish color. You can look at this, both women, that is obese, and severely obese people, that is obese men and women, and severely obese men and obese women. You could see that an exponential increase is going to happen. That is almost a great number of increase in the next 10 years is going to be the projection. Okay. It's going to be the projection. Now, if you look into that, there is one thing very interesting that most of you must not be aware, what is called as the National Family Health Survey, which is done every 3 years in our country. Look at this, you can see in the right side of the, left side of the screen, you can see that between 15 and 16, the total obesity was 20%. Okay, that is overweight and obesity together. It is 20%. And look at this in 2021, that is in 3 years' time, it has increased from 20 to 24. And in men, 19 to 23. Already in 3 years, there is a 4% increase. And this is not going to be the same. The increase in obesity is going to be more and more like what has been projection has been shown in the previous slide. Now, 2024 is yet to come. 2024 is yet to come. And once we get, we'll have a better idea. I think the National Family Health Survey is going to give a good idea of what is happening with the survey that they have done. Now, it is not the obesity that we are thinking about, okay? You look at this National Family Health Survey. Again, it said that in 2000, about 3 years ago, what they have said is that 40% of the women, okay? 40% of the women and 12% of the men are abdominal obese in our country. Again, women are having the more problem in our country. And then 50% of the women in the age group of 30 to 40 and 57% of the women in the age between 40 and 90 cross the cutoff mark of the abdominal, that is the waist circumference basically. And then if you measure the same people with BMI, you just see the difference. BMI is only 23% of the people have got a cutoff point of 23 BMI. Right? 23 is a cutoff point in our country for BMI. And now recently the Anup Mishra group has reduced it to 21.5. And there is no overweight, I believe. He says that beyond 21.5, it is obesity. That's all. No change. That's what he has said. But anyway, our WHO and our Indian authorities say that 23% only. So this is what is called as yesterday and today we have found that the so-called Indian phenotype, what is called as thin fat Indian. BMI not been very high. Only 23% are having a cutoff point of beyond 23. But most of the more than 40% of these people are having abdominal obesity. This is the problem. We have to double them out. So just looking into BMI alone may not be a great indicator to find out the obesity amongst people, but look into waist circumference as well. And now this is what happens. If you can see that, if you are normal weight, still about 52% of the people will have abdominal obesity. And if you are underweight, 34%. And if you are overweight, 65% of them having abdominal obesity. And then if you are obese, 75%. You are not spared. Now, abdominal obesity. And then you can see, so it is about 65% of the overweight and 73% of the obese individuals had abdominal obesity. Now, let us look into the waist circumference. Again, waist circumference is country specific. Country specific. The IDF and WHO said that you should have your own normals for waist circumference. Like BMI, we have our own standards, and then even for waist circumference, we have got a different standards. We cannot copy from other country. So you can see that our cutoff points for waist circumference is at 80% in women, 94%, 94 centimeter, not percent, 80 centimeters for women and 94 centimeters in men. And if you look into this, the prevalence of abdominal obesity according to the waist circumference amongst women in India is quite high. About 4 in 10 women having a waist circumference higher than the prescribed cutoff mark of abdominal obesity. So if we have the waist circumference, almost 4 out of 10, 40% of the women are having abdominal obesity. And similarly it is look into the state-wise. I think Tamil Nadu is making waves. You could see here. Tamil Nadu is making waves. You can see that NFHS3 is about 6 years ago. You could see that Punjab, Kerala, Tamil Nadu are the highest one. And you look at the increase that from Tamil Nadu from 29 about 6 years ago, the obesity and overweight has gone up to 46%. See that? It's almost 50% increase. And look at the northeastern states. 6 years ago, they had hardly any overweight or obesity. And you look at in 6 years what has happened from that, say for example, Arunachal Pradesh, which was 11, which has gone to 29%. So this is the amount of overweight, and we are seeing this is going to be explosion of obesity that can happen. And there's one more way they're looking into, easy way of looking into this is that how various states are increasing. You can see that Tamil Nadu, in 6 years it has increased by 17%, plus 17%. You could see that Andhra Pradesh is doing great job, actually 18%. Can you imagine Odisha? Odisha, you can see that 22%, 22 plus, 22%. You cannot imagine this, right? So even this northeastern states, which are supposed to be very thin people and do lot of work and all. Yesterday there was a discussion on this, and Himachal, I think P.V. Rao was speaking about that, and they used to go to hill places, go up and down, and now they are not doing that, and the obesity is increasing. Okay, so this is what is happening. This is the real world, and the most disturbing thing that we could think about is that epidemiology of the overweight in under 5 children in India. Look at this, 1.89% about 6 years ago, today it's 3.94%. It's almost doubled. Doubled, even at the age of 5, our obese children. And then, it's a very interesting thing actually. Suppose you have, why is it happening? Why even, you can see that even Dr. Ramchandran was speaking in the morning. You could see that urban has gone to a plateau, he was telling, right? He was gone to a plateau, and towns and villages are increasing in obesity and diabetes, right? He was talking about diabetes, but also obesity. Now, this is what is happening. By an urbanization of a town or a district headquarters, if it extends by 1 kilometer towards a village, just 1 kilometer, there are additional 3 people will become obese. Very interesting. This is urbanization, industrialization, economics, and then lack of physical activity, more food. You know, in fact, I come from a small town, and you know, people, the factories around that, they pick up people in the morning, they give them breakfast, they give them lunch, and they give snacks at evening, and the only thing they have to cook at home is dinner. So that is what is happening. So it's a sitting job only, actually. So urbanization is happening, and so that obesity is also going to, if every 1 kilometer increase in the urbanizing area will increase about 3,000 women can develop diabetes. So it is nothing but macro level development in states is both correlated with the greater urbanization as well as a greater obesity. Now, if you look into the projection of people with overweight or obesity in our country compared to 2020, you could see that it is going from 24% to almost 60% in the next 20 years or so. Imagine the explosion. This is the projected values that we can think about. So it is increasing in obesity. Now, how is it can cause economic burden as well on our people? Is that we know that as the BMI increase, as the abdominal obesity increase, we know that both women and men will increase diabetes, hypertension, cholelithiasis, and coronary artery disease. All those things you have to pay for that, for treatment, right? So that's one thing. And now, if you see that mortality, look into the BMI and mortality. In men, if you see that in the overweight category, when they come into the center of the overweight category, then it starts going in towards obese, the mortality increases. Whereas look at the woman, it's entirely different. At a lower overweight, it starts increasing, mortality is increasing. So this is another thing what we have to look at. So women should be taken care of better. And you can see that Medicare spending is rising significantly faster in overweight population. Compared to normal weight, overweight and obese people, you can see that amount of money that you need to spend for a future treatment is going to be exponentially. That is, whereas you can see that inpatient cost, outpatient cost, and total cost, you can see that it is going to increase. Now, look at the GDP. Now, India is having now spending 0.8% of the GDP on management of obesity. Now, in the next 20 years or so, it is from 0.8%, it is going up to 3.4%. So the GDP is going to be 3 times more GDP has to be spent on managing obesity and its problems. So it is going to be the huge total economic cost in billions over the time. That is actually is in India, but they are calculated in US dollars. You can see that from 2020 to 2060, the amount total number of cost of millions of dollars that you need to spend, or the crores of rupees that you need to spend, is going to be exponentially high. And that, as I said, that GDP also is going to spend more time. So even total economic cost per capita for spending for each person who has got obesity is going to be very, very high. Now, whether weight loss can reduce this cost, that's the most important thing. Yes. If you have a very good weight loss, you could see that there is a decrease in cost. That is, if you reduce 50% of the weight loss in 2 years, it reduces. And if it is permanent, that is for 2 years, a permanent 5% weight loss, we can see that more expenditure comes down. And 10% weight loss is going to come down, the cost is going to come down to almost 50%. So it is not only health effective, it's also cost effective as well. So both cost and health effective is a possibility when you have obesity. Now, you can see that more and more youngsters, adolescents are going to have, these are the people who are going to be more and more obese and overweight in future. And the teenagers are having, is there an evidence that we can intervene and then we can reduce the obesity in future and the cost can come down? There's one nice study done in Greece. What they have done is they have taken 30% of the children were centrally obese in that Greek, and they've taken and they gave them, ensured that they're compliant to the recommendations. They gave Mediterranean diet. That's one of the, after our traditional diet, Mediterranean is the only fancy diet that we can subscribe, not other diets, which are more practical for the so-called fancy diets. And physical activity levels are increasing. Sleeping hours are also improved. Sleep health, very, very important. We don't realize it. Sleep health is very, very important. 6 to 8 hours you need to sleep. Sleep hours and sedentary activities and the decrease in risk of total and central obesity in both the genders. There is a statistical difference. You can see that in the bar diagram. In about 3 years, you can see that there is a reduction in overweight and other things, and it is cost effective and health effective. It is possible to do that. So friends, you can see that the obesity is going to be not just an epidemic, it's going to be a crisis in future. Look into that. The possibility of a good intervention now will have a better generation to come next. Thank you for your patience.